to continue, we talked about what's available now, which is the intravenous form of Edaravone, but there is an oral formulation, which is a liquid that's being developed and studied. And the testing to date, what's been looked at to date? Well, how does oral versus getting an IV compare when it comes to measuring the levels in the blood, what we call pharmacokinetics or PK? And does it, if I give it orally versus IV, does it stick around as long? So the levels that it reaches and how long it sticks around is called pharmacokinetics, and I've called that PK. That's the sort of abbreviation for pharmacokinetics. And then if I give it orally versus if I give it in a feeding tube or an NG tube, is it the same? Is it the same pharmacokinetics? Does it get to the same level in the blood? Does it stick around as long? And what's better? Is it better to give it orally in the same frequency like we're doing the IV, 10 days out of 2 weeks and then 2 weeks off, versus giving it daily? And those are the kinds of questions that are being asked about this oral formulation. And so what's been shown so far is that if you give it to healthy volunteers and you compare giving it intravenous versus orally, it shows a similar PK. The same plasma concentrations are reached, and the same kind of time duration, how long it lasts in the blood, is similar. And similarly, when you give it to people with ALS, that PK of oral Edaravone compared to IV was similar to when you gave it to control. So again, oral seems similar to IV in people with ALS. And when you give it in the NG tube or, per peg, per feeding tube, in both controls and ALS, there's a similar pharmacokinetic appearance to oral versus IV. What all of this means is, okay, it looks like the IV, it behaves like IV in terms of how much concentration is found in the blood and how long it lasts. And all of that means that it can be given by peg or by mouth and behave in the same way when you look at the blood levels as when you give it IV, suggesting that, of course, it's comparable. The adverse events that were recorded with the oral agent have been mostly similar to ALS progression, and the safety results were generally consistent with the safety profiles of the intravenously given drug. And so far, we've looked at an open label, meaning no placebo, no sugar pill, no sugar liquid in this case, in 216 folks. They were given oral Edaravone in the same frequency that the IV is given, so that 10 days out of the first 2 weeks of the cycle, and then every 2 weeks off, and then another cycle of 4 weeks where during the first 2 weeks you get the drug. And they looked at the safety and the adverse events, and the secondary exploratory endpoint was whether or not how the ALS FRS behaved, whether or not there was a slowing of disease and survival. So 185 folks received oral Edaravone, and 160 folks completed that 6 months of therapy. 78.9% had an adverse event with treatment. Most commonly, it was things that were consistent with disease: muscular weakness, falls because of weakness, fatigue, back pain, constipation, and so forth. 21 patients, or 11%, 11.4 to be exact, reported a serious adverse event. And most commonly, these really reflected progression of their disease: dyspnea, which is shortness of breath, and respiratory failure. There were 6 deaths on the study, this 6-month study of oral Edaravone, and 3 were due to respiratory failure. 1 was, which of course could be progression of ALS, 1 due to ALS, one felt to be due to pneumonia, and one was unfortunately suicide. Only 11 folks, or basically 6%, discontinued the drug. And the reasons were progression of disease, respiratory failure, and weakness. And when they looked at the ALS FRSR decline, that was comparable to the decline that was seen in that study by which we got IV Edaravone approved, the way that the drug worked in the IV, and the decline was similar in with the oral. And so that's the results to date. There's now an ongoing phase 3 study, which is looking at daily oral Edaravone versus the cyclical oral Edaravone. So can we get more bang for our buck if we give it every day, is basically what's being looked at.